Just this past weekend, I reached the first 365 days since I first heard the word tumor as it related to my right eye. And that was on the 11th of November, 2022. I'd been seeing flashes and floaters, went to the optometrist, and I think I described this story in my first taping of this pretty well. I'm now at 365 plus 3 days, so 368 days since I first heard the word tumor. The tumor was first in my eye. The cancer was first in my eye, and that was I described in an earlier taping exactly the processes of what happened there. The biopsy that they did on the 6th of December came back in the riskiest group, the highest risk category, 75% chance within 5 years of it metastasizing in my liver, which it's already done within the first 7 months since that. So that actually 8 months was detected in the MRI I had at the beginning of August. And that has now been the main concern. There are plenty of other issues that keep showing up in my various scans. I've had now 3 CAT scans, 2 MRIs, and a PET scan. The PET scan was the most recent and is done on a molecular level. So it's much more expensive, but it seems to be the readout from that didn't show anything new. It showed that there are not only 2 tumors in my liver, but there are other areas of concern, 5 or 6 that they've found recently in the most recent CAT scan and in the most recent PET scan in my liver. But they're also looking at a spot possibly in my lung, which there was a spot in my lung in my first CAT scan that happened before I even had the procedure on my eye. And it seems to be there in all the readings, but not necessarily growing. So maybe since I keep seeing that without it increasing in size, maybe that is something that is of less concern now, but I'll find that out when I go tomorrow. Tomorrow, I'm scheduled for my second infusion of immunotherapy drugs, Opdivo and Yervoy. And the first of these, every 21 days, was on the 25th of October. And it was not that bad of an experience. It's a private room. There's a comfy chair. Dad sat with me. We watched sports TV. I was in there for a little over an hour, and it was seamless. And I had no side effects then. The first side effects I felt were the next day. And one of the possible side effects was that areas where I have osteoarthritis, so impact damage to joints, my left knee and my left hip, those were, yes, very painful the next day, and continued to get worse and stiff and inflamed and sore and pain. And really great nurse, practitioner who walked me through this and said that if there's any issues with the pain from the arthritis that I explained to her that I had, that to let her know, and I did on the app on my phone for the cancer center, and it works great. I just texted her with the secure text that I had an issue, and she replied, and then she wrote a prescription for me, and I picked it up. It was very seamless, and that was for a steroid that has brought down the inflammation and pain somewhat, but it's something that I was treating with non-steroidal anti-inflammatories, NSAIDs. I was treating it with naproxen and aspirin occasionally, and Voltaren, which is a topical NSAID, and I can't use NSAIDs with this immunotherapy drug. So that's the way forward for me, is to keep the inflammation down somewhat with the steroids. And And I'm continuing to stretch and exercise. I still go 3 days a week to swim at the Y, and I do yoga and light weights and core work 5-6 days a week. So I'm continuing to feel strong. I still have no symptoms that I'm feeling any discomfort or anything that I can tell from what's happening in my liver. So the PET scan happened last week, and that, I was told, was as much to see what else was going on in my body that could be of a concern, but also to sort of set a point in time to see whether the immunotherapy is actually slowing the growth, retarding the growth, stopping the growth of the what's happening in my liver, these spots of interest, as well as the two larger tumors. I've also, since the last time I've spoken, met with 3 different teams that are part of the whole oncology effort at Parkview Cancer Center. And really, I spoke with a surgeon. I spoke with a person in charge of what's known as the cyberknife radiation. And I spoke with a person that would be doing something called CERT, or Y90, which is something that I sort of gathered from the information I got from all 3 of those teams, that's possibly the next step, is to do something known as Y90, which the things that I'm learning is that so many of these procedures dealing with getting things into the liver now are minimally invasive and pretty much done as outpatient. So cyberknife, they would be using lasers that sort of meet at one point. They would have to go in, again, minimally invasive, and put in 2 little markers of gold on each of the tumors, and they would radiate them with a cyberknife where it would target only the cancer cells using lasers that would be targeted. But that would be non-invasive. There'd be a little burn on the surface of the skin, but they would be doing the burning where those 2 lasers crossed, and that's a possibility. The Y90 is a procedure that would go put into a blood vessel, go up to near my groin and up into the femoral artery and then into the liver, and they would get as close to the areas of concern as possible. And first time through, they would release a minimal amount of little radiation markers, and they would just see where they gather. Because the idea is to get really little, and they mentioned they were about 1/3 the diameter of a hair, really little flakes of radiation in the capillaries surrounding the areas of concern, the tumor. And they would then sit there, and their half-life's pretty quick, but they would be radiating a small amount of millimeters around the area where they're lodged, and that would retard the growth of these tumors, hopefully. There is only so much radiation, however, that they can introduce to your liver in this manner. So those seem to be the most likely next steps. I go back tomorrow for my next infusion of these 2 immunotherapy drugs. I'll have another one scheduled tentatively on the 6th of December, and another one scheduled on the 27th of December. And then if those are successful, they would continue with one of those 2 drugs, Opdivo, every 28 days infusion following that, as long as it seems to be working. And that would be in addition to whatever the next step to target the concerns, the cancers in my liver. Stage 4, it is metastasized in my liver. That's what stage 4 cancer means. It means that you've gone from one organ to another organ with the cancer, that it has metastasized in another organ. That's what stage 4 means. My cancer is, as they keep reminding me, they have no cure for it. So the optimal outcome is to prolong it taking over the liver as long as possible, and to live as well as healthy a life as I can. And right now, I have a couple bothersome things that are the osteoarthritis I have in my left knee and my left hip, and go over to my L1 vertebrae, as it turns out. And these are things that have come up and been shown in my various scans to be a problem. And I knew it was a problem, and it's been a problem because of injuries and impacts for much of my life, and it was getting worse. And my intention was over the summer of 23, when I had close to a 2-month break between the 7th of July and the beginning of September, that was when I was going to have my hip and knee addressed, and that was all put aside by what happened just a year ago to my eye.